First, welcome to Medicare. You're bucking the trend a little bit by moving to this state, but we assume you have your reasons for that. So let's dive right into how that works with Medicare. Whether you have a Medigap plan, Medicare Supplement in your prior state, or you have a Medicare Advantage plans, every state's completely different. So we're going to give you a good introduction to how to look at Medicare options in California, how to get the best setup for your situation, and we can help you along the way with the whole process. Let's jump right into it. We're going to break it up for Medigap, Medicare supplements versus Advantage plans because they're totally different markets in any state, but definitely in California, and we need to look at that first. Let's first start with Medicare supplements, and then we'll take a look at the Advantage side of things as well. All right, let's say you have a Medicare supplement in another state and you're moving to California. How do we handle this? First of all, understand that the Medigap Medicare supplement market is regulated at the federal level. So a G plan or an F plan is going to be identical both in terms of benefits and in terms of network, meaning you can see a Medicare provider, doctor or hospital in any state across the board. You refer yourself out. So that's not changing in any way. If you have a G plan in a prior state, you can even bring that G plan with you, although it usually doesn't make sense based on cost, or you can get it or shop for a new G plan here in California. And we're happy to help you with that process because the pricing swing between different carriers for the exact same plan can be all over the board. Let's double check. This is the perfect time to see where the pricing is best for the major carriers. And we run those quotes all day long. We just need zip code and date of birth. We can run the supplement quote for the one you currently have, for example, a G plan or an F plan. And we can look at that process of moving over here because that's pretty easy. We can enroll. It's a qualified event because we're making a big move. And we can look at getting different coverage here in California if it makes sense for your situation. And we'll let you know right away. So that's the Medicare supplement piece. That's pretty easy. But if you have a supplement, you probably have a Part D for medication as well. Part D is definitely going to require a change because there are different plans offered from state to state, even within the same carrier. For example, United may have a plan Part D in Texas, but they have different plans and rates and options here in California. So as soon as you move or prior to moving, we want to kind of get the ball rolling and run those quotes for you because the earliest effective date we're going to get is going to be the first of the month following the enrollment. That move from the region in another state to California is a qualifying event. So we definitely want to apply as soon as possible for the Part D here and also for that Medicare supplement. And we'll run those numbers for you across the board with the major carriers. That's the Medigap piece. It's pretty easy and we can guide you through the whole process. There's no cost for assistance. Let's look at the Advantage piece, and then we're going to talk about one little hidden gem that we have here in California that they don't have in other states for Medigap and making changes. All right, coming to California, moved here, and you had an Advantage plan before, and you want to keep Advantage plans. You like how they work. You like the cost structure. We have a whole video on California Medigap, Medicare Supplement versus Advantage plans if you want a kind of a refresher, because it is different in California than other states, and it's even different according to the area you move to in California. For example, LA County has a huge market for Advantage plans, super competitive, but if you go out to more rural areas, it's going to be very different in terms of how those are structured. So that's point one. We want to rerun the quotes for your new zip code across the board. We just need zip code, your date of birth, any medications, dosages. You probably don't have doctors here, and we can help you kind of guide, and we'll talk about that in the next section in terms of networks. But give us that information. We'll run the quotes for you for free and see what's out there across all the major carriers. So that's one piece. When you move out of another state to California with the Advantage plan, you're going to have to change. You can't keep that Advantage plan that you had in another state when you move into our state. You definitely have to change. It's a qualifying event making that move. So pretty quickly prior to your move, like the first of the month, let's say you're going to move here mid-May, we probably want to get that new plan started May 1st, as long as you have an address here in California. The reason being is otherwise June 1st will be the next available effective date. We can only get the first of the month following enrollment. A little bit of a timing issue here, and we can guide you through to make sure that's seamless and you're not without coverage. So, Advantage plans, we have one of the biggest markets in the US for Advantage plans for Medicare in California. Let's run the numbers. And we have a tried and true kind of process to quote and compare the different Advantage plans. We have a whole video on that where we look at the star rating, we look at the out-of-pocket max, we look at the monthly premium, we look at Part B givebacks, or a lot of different options that you may have in your new area in California that you didn't have in the prior state. So we want to kind of run the full array of options. If you do have doctors and hospitals, let us know who they are. We can plug that in. More importantly, we can give you guidance if you're in an area who's solid in that area, because you're probably new to California in terms of that, unless you're moving back. That brings up the whole point of doctors, and that to some extent medication, but really doctors and hospitals is a big factor on the Advantage plan decision. Let's turn our attention to that piece now, because that's really critical. Medicare supplements, it's pretty easy. You can go to any Medicare provider. Advantage plans, your selection of doctors in your network becomes very critical. Let's touch base on that first, and then we're going to talk about that secret kind of gem we have for the Medicare supplement side in California and a few other states, but really a lot of states still haven't done this. Okay, this is a very broad overview. You really need to reach out to us for your individual area and situation, and we can touch base on it. In California, if you're looking at the Advantage side, we have huge networks that kind of dominate the scene, especially on the hospital side. So you have the UC system, and they're really sharp, whether it's UCSF up top, UCLA in LA, UC San Diego. These are solid medical networks and hospitals that if you can get access to, they're some of the best out there. Down in LA, you also have Cedars-Sinai and a range of different options depending on where you live. Some Advantage plans will work with different medical groups and hospitals, others won't. So that becomes a key driver. Once we see, for example, in LA County, you're going to have a lot of carriers with benefits that are pretty comparable. No premium monthly, a low out-of-pocket max, many with good star ratings of 4 or more. So we always go according to that because that shows how happy people are with the prior plan. The difference, though, is who they'll work with. So one may work with Optum, which is a giant medical group, kind of East LA, good Pasadena and such. Well, we then want to target that and the different hospitals out there according to where we live. If you go up north, Sutter is a giant player. Sutter is this huge chain of both medical groups and hospitals in a lot of areas from all the way from Sacramento over to East Bay and even to the general Bay Area. We're probably going to want Sutter, but if you're up in the city in San Francisco, UCSF dominates there along with Kaiser. So Kaiser, again, is a whole nother ballgame, which is super strong in California, depending if you have a Kaiser facility by you. So there are a lot of pieces that really hinge on the doctors and hospitals in your area, the plans that work with them. So if you're new to California, let us know that. And for your area, we'll kind of give you a heads up as to where to focus. So, Sutter up north, the UCs in certain areas. As you go further south, you have Sharp, you have Scripps, you have different areas in San Diego. Reach out to us and we can kind of guide you a little bit as to who is strong in a given area, both in terms of medical group and hospital. Because that's, for people who are new to California, it's kind of, they have no idea who to go to or where to look at. We can give you some general guidance on that front and then run plans and quotes that are valued, good values on the market for that situation. That's a little bit of a kind of insider info we can pass on to you. Now, for the Medicare Supplement Medigap piece, let's talk about the secret weapon we have here in California. As independent brokers that work with all the major carriers for Medicare supplements, we love this. And a lot of states don't have it, but California does. It's called the birthday rule. And what it means is around your birthday every year, you can change plans, a Medigap plan, from the same level you have now to a lesser level, regardless of health. This is beautiful because before it was subject to health. And if you had health issues, you might be stuck with a carrier that's getting more and more expensive relative to other carriers. Now that's not the case. We have a whole video on the birthday rule in California, how to take advantage of it. But the range of pricing within a given plan, for example, the G plan, the most popular current plan, between the carriers, it's crazy. It can be $100 a month from the lowest to the highest for solid carriers. Identical networks, identical benefits, and we go into why there's this giant range of pricing for the same plan in another video, because a lot of millions of people are just overpaying. They're just giving money to the carriers, and it drives us crazy. We also looked at people going from the F to the G, why in a lot of situations that can make tremendous sense and save them quite a bit of money as well. So if you're new, you want a Medicare supplement in California, we just need zip code, dates of birth. We'll run the numbers for you. Let's see what the spread is and who's priced better. We'll shoot that over to you. We do it all day long. There's no cost for assistance, and we'll get that to you right away. Knowing that with the birthday rule, at the end of each year, we can change plans. So we can go from a G to a G, an F to a G, for example, regardless of health every year. So we want to double check and price shop the market to make sure we're not overpaying. So that's kind of our little gift to you, because we hate seeing people overpay for the exact same plan with carriers that are just hoping you don't know any better and won't check. We'll check for you. So no cost, reach out to us. Hopefully this helps. If you're new to California, again, welcome. Reach out to us. We're happy to navigate the whole process for you to make it easy on the timing, the options, and we'll do that. There's no cost for assistance. So let us know how we can help.